Activity 2, Interpreting Modeling Output to Help Inform a Decision. For Activity 2, you are given one public health decision-making scenario and 4 modeling outputs for consideration. Review the 4 modeling outputs and consider: what type of model output are you looking at, and is this appropriate for the situation? What input data were used, and what are the limitations of this data source? What assumptions were made to generate this model, and were the assumptions reasonable? To review the scenario, it's October and you're the state epidemiologist. Healthcare coalition partners in your state are seeking your advice on whether and when to hire medical surge staff during this example respiratory virus season, given the specific context in your state. You are given 4 pieces of evidence to consider in the form of historic trend data and modeling outputs. We'll review each one in turn, starting with a look at historic data. You asked your state health department colleagues to look back at local hospital reporting to the state health department over previous years and show the timing of the peak week for hospital admissions for RSV, influenza, and COVID-19. Some seasons of RSV and influenza were excluded as timing and severity were altered by the COVID-19 pandemic. Historical trends indicate that peaks of COVID-19 and RSV are common in late December or early January, often around the same time, while influenza tends to peak later in the respiratory season. This figure is not looking out into the future, rather it is providing historical trends that are informative of what to expect in the upcoming season if the spread of these pathogens is comparable. Next, we'll take a look at some specific projections for the COVID-19 peak this year. Your respiratory disease epidemiologists have been working with a local university to generate scenario models for COVID-19. This figure shows the timing and magnitude of peak hospitalization week for the forthcoming respiratory season. It's a scenario model because the 2 scenarios considered are 1, assuming no additional new variant, blue points, and 2, assuming a new Immunoscape variant, red points. The university conducted 100 simulations for each of the 2 scenarios. Each point represents the magnitude and timing of peak hospitalizations in a single simulation. In simulations from Scenario 1 with no new variant, the model estimated a smaller peak in late December or early January. In simulations from Scenario 2, with a new variant with Immunoscape, results showed a larger, later peak, but the expected timing is uncertain. As we discussed in the first section of this training series, scenario modeling can be a powerful tool for framing what may happen over the course of a season or outbreak. A scenario model uses data inputs such as surveillance data, vaccine effectiveness, vaccine uptake, variant Immunoscape properties, and other public health interventions. It's important to note that in this example, COVID-19 is the only pathogen being considered, so your view of what happens for respiratory virus hospitalizations is limited based on this model output, but it can give a piece of the puzzle when making your decision about surge staffing needs. We will review the other 2 pieces of evidence and our suggested decision in the next video.